I want to get to your work experience, ComServe and beyond. How was your undergrad like? Maybe let's just combine it, undergrad and postgrad. Well, postgrad would be now you when
Yeah.
you're busy after ComServe. How was your undergrad?
Undergrad was an
How do you
experience,
find
eh?
it?
I think it was a journey. For me, it was like a whole emotional journey and a spiritual journey.
I can imagine. I mean, you were
So,
not prepared for this. You came for the money.
yes, you know, when you come for the money, you hear on the first day, like, yeah, if you don't go to work, they stop your salary. And I'm like, damn, I need to go to work. If you don't come to class, they stop your salary. I'm like, I need to go to class. So I knew there and there that class, work, Mina, I want my money in my account every month. I don't want my money not to be, I can't survive. So I need to pass and I need to go to work.
Nothing should mess this bag.
So and I need to nurse the salary because clearly I need it. You know, I go into nursing and I'm like, yo. I remember the first day when I met my classmates, everyone, and I'm just sitting there and I'm like analyzing everybody. I know people introduce themselves, and there were these people that were introducing themselves. I was like, I love nursing. I'm like, where do they know nursing from? These ones. Clearly, I'm the only one that doesn't love nursing. You know, I was just like, where do they know nursing from? Wow, okay, that's good. Then, you know, you go to class, you learn. I think my biggest fear was physiology and anatomy. Those are my highlights. My first 2 years.
Oh, because you
My
didn't do
highlights.
biology.
Yes.
Oh, yeah.
I had commerce subjects in high school. So now I'm like, I'm going to fail anatomy and physiology. If I do not study, there goes my salary. If I fail these subjects, I repeat, they take my salary. So I need to pass those two subjects. Because other things, you know, social sciences, psychology and sociology, I'm going to work through them. I'm gonna survive. I'll be fine. And you know, the way I was so anxious, like to just walk into a hospital and I'm waiting for that clinical day and I'm like, God, help me. Can I not kill somebody? you start saying, like, wow, so I'm going to take care of a patient. When you do your first vital signs, you're shaking, you like, and you're hoping that it's not an abnormal vital sign.
Because I don't want to go beyond this. I don't want to call the sisters.
I don't want to call the sisters. I don't want to report it to. I just want it to be there.
Yeah,
Then I write it in the file. So my first year for me, I think I was just finding my bearing. You know, it was like bearing type of thing. I'm finding my bearings. I'm finding where I'm standing with nursing. I really didn't know if I liked it. All I was focusing on is passing.
Yeah.
Because I want to pass. This is the only degree that I have a chance of finishing. So I cannot destroy this. I cannot mess this up. So I need to study as hard as I can. I studied. I don't want to lie.
What was, I remember, if I remember correctly, man, we wrote this baseline assessment test. The
one in anatomy,
what
the
did
lab.
you get?
I got 8/20. It was out of 20.
It was out of 20.
Yeah,
In percentage, I remember I got 3.25. That's the lowest percentage I've ever got in
I got
varsity.
8. And I was just sitting there like, how did I even get to 8/20? But that was hard because I didn't even know a thing.
Oh,
I didn't know even, I was literally guessing. That was guesswork for me.
it was bad.
I got 8/20. But then, do you know what comforted me was, no, this is just background knowledge. And I don't have this background knowledge.
And there were people that did, I mean, like me, I did physiology. I mean, I did life sciences in high school, but I got 3.25%. You know, I remember I think it was Mhlungu or Coops, and I showed them 3.25%. This guy is like, yes, this lecturer doesn't even have a heart. Why would she even convert this?
3.25.
3.25. That was the first ever physiology mark I got.
Wow. But for me, that was, we had not been taught. I think I comforted myself with that. Like, nobody has told me. I'll probably worry with my first test, after I've been taught.
Yeah.
And I remember my first day in class, and it was on the 4th of February, our first anatomy class, and that morning, hey, we walk into class, people are already singing subscapular fossa, olecronian process. Do you know what? Like that Tuesday morning, I call my mom, I'm crying. I'm like, Mommy, I don't know why I chose nursing. There's people that know the scapula. I don't even know
structure, function, and location.
They know the lateral posterior, anterior. I don't even know what that is. I'm like, I was crying. Literally. I'm like, I don't know if I should continue. Because if I leave now, at least I haven't tried, you know. My mother is like, when did class start, Kwanele? Like yesterday. It's like, go back, go to class. Go to class. Stop crying about nonsense. Class started yesterday and you're already crying that you don't know anything. Go to class and learn. Read as much as you can. I'm giving you this opportunity. I'm taking care of your child right now. And you're going to go to class. You don't have a child to take care of. You're at res. The whole point is for you to study. Don't stress about anything. Take your textbook and read. Class started yesterday, Amos. There's no one who was taught before you on Saturday, on Sunday. No. So go to class. You will pass. And stop making noise for me. Go to class. And I just, you know what, wipe my tears. Went to class. And I'm like, I'm going to try and listen here.
Kwanele, you were going through a lot.
I was going through a lot.
I'm the thinking, yes, I'm the only one suffering
I
here.
am crying every morning. You know, my thing is when I feel like I'm defeated, I cry a lot. I just cry. Especially mornings. Mornings are my most emotional. You know, I'm more emotional in the morning. It's like even when I have to, if I had to drive to work and I start talking to God in the morning, I start crying. I'm just so emotional. I have so many emotions in the morning. Yo, the way I was crying. And I'm like, how is it? Now there's the first test of anatomy and physics. That was the first before other tests. Then I'm like, I studied and I wrote. I got 78%. I'm like,
Hey, yo.
wait.
Hold on now.
Now, what is the distinction again? 75. I'm like, I got this. 75%. Anatomy and physiology. Me?
The thing that scared me most.
What? You know? And then the other tests start coming. I'm getting distinctions and I'm like, wait a minute.
I can do this.
So I can actually study and get good marks. No. You know? And then physiology also. Physiology was so funny because I struggled to get 70. Like just to get to 70. I remember with my second test, Petra called me to her office and she was like, I want to ask you something. I want you to look at your test papers. Have you noticed that you get 69% for both of my tests? My first semester test and my second semester test, I got 69. Have you noticed that you skip questions? I'm like, I didn't notice. Like, you skip questions. And I think if you start writing a question and then cancelling and be like, I'm done with this question, write the question, cancel the question paper, you will. When I'm calculating the marks that you always lose, you can get 80%. I just wanted to tell you that. And for me, that was profound. That someone literally looked at my paper and was like, no, this student can get a distinction. This is the problem. I swear to God.
So wait. So what are you doing? You would write and skip
I get excited.
questions. Oh.
I really get excited. You know, and then I skip a 5-mark question. Then I lose those marks. I don't get them. Because it's just like every question that you lost, you didn't not get 4 marks on it. And look at all the other questions. You're getting good marks. If it's out of 9, you get 8. If it's out of 10, you at least get 8 or 9. So those ones that you skipped, I think you would have gotten 5 or even 3. And then that could have totaled it to 80%. So do this because it was about to be the first exam. Like, do this for me. When you write question number 1 and finish it and cancel it out. Then go to question number 2 and cancel it out. Then when you're done, go back to all the questions and see you wrote them. You won't believe that my marks moved from 69% in semester test to 90 in the exam.
Oh.
I could not even believe when I saw my result.
Peter was a mother, bro. You know, I owe Peter a gift. I don't know.
Yeah.
When I failed,
she was a mom.
When I failed my on the second semester, I failed physiology, right? I think it was the exam. Failed the exam. Oh, I qualified for a supplement.
Yeah.
Wrote the supplement, failed. Then she was like, called me in the office with Mandla Louise. I don't know if you remember the guy, Mandla.
Yeah.
Called me with Mandla Louise. Said, the optom, was it the optom or the sports science? There was this group that we were sharing a class with. It's like they're writing. I'm going to give you another chance. But on this day, when we are writing, test, I think it was around 2 o'clock. I want you here at 7 o'clock in my office. Dude, we went to her office. She made us coffee. We sat, and she was like, I want to see you studying.
Wow.
Like literally, she's like, I want to see you studying. If you have questions, I'm here.
Wow.
From 7 to 2, I'm there busy consuming coffee, studying. I remember, I think around 10 or so, Mandla was like, no, now I know it. He left the office. She came back, she's like, where did he go? I'm like, no, he said he's good. He said he's good. I was like, and then when are you okay? I'm like, no, I'm still going to be here.
Yeah.
Dude, from 7 to 2, I was seated in Peter's office studying.
Okay.
She took my phone, took everything that could be a distraction, and she was just there to answer anything. She's like, okay, you are done with the fate of the spam. You know it. Yes. Are you sure? Ask me questions on the spot there. What's happening here? What's happening here? What's happening here? By the time I was done, I think it was, she left me around 1:30 or so to go set up in the other class. I went there, I wrote. I think I got like 50 something.
Wow.
And I passed. To this day, if it wasn't for Pedro doing that, I don't think I would have left to, like, I would have passed to go to second year.
Yeah. And Pedro went the extra mile, eh? She
She's
did
like a
things.
mother,
She did
bruh.
things that I don't think were even allowed at academic level. She gave too many chances. Like, at least let's push, let's get there. And she was so observant. That is what I loved about her, because for someone to actually come and say to me, you can get this mark, but you're doing this. This is your habit.
And this is a problem.
And this is a problem. Here's the strategy. Do this instead. And I remember she even asked me, how do you study? I'm like, I cross night. She's like, stop cross nighting. Stop it. Study during the day. Don't cross night. Don't drink BioPlus. Don't drink anything.
Hey, that thing we used to drink.
Study during the day. And do you know what happens with me and the things like energy drinks and BioPlus and coffee? They work only once. After that, it doesn't work. I crash. I sleep. So she's like, stop cross nighting. Read during the day. After class, that time from 4 o'clock till 6 o'clock, take your time and go through all your work. Don't cross night and see how you improve, because you're not well rested. That is why you skip questions. You're not alert.
You're tired.
You're tired. And when anxiety tops in, you don't see other questions. You skip them. You think just because you've answered this fully, you're done. No, you're tired. So stop that. I literally stopped that. My marks went from the 60s to the 90s. And I became the top student of physiology that year.
And people,
You see, and Pedro, bruh, no one
I was
would
like,
say this. We really,
Wow.
I for one, I really owe Pedro
Wow.
a thank you. Because after that, I think my confidence was boosted. In second year, yes, I was not passing, but at least I knew that when I want to start, I need to do this. And that was because of the foundation that she built.
Yeah.
Who's this? Was it Eagleton or
Yeah.
something? The one that used to say, sit on your bum. If we got Eagleton in first year, I don't think I would be a nurse today. Nope.
It is.
That one, she was like,
Sit on your
I'm like, I don't understand. Like, it's because you don't sit on your bum.
read.
Read.
No, like, guys, it was tough. You know, I then that moment, you know, when you look at people think nursing is like a joke. You know, like, yeah, you just studying nursing. The information that we have to go through, that you have to read, understand, the amount of anatomy and physiology that you have to do, the lab work. The lab work. You're seeing a microscope for the first time and you have to tell me, is that an epithelial cell? Squamous? Is it simple squamous? Is it cuboidal? Is it... and you're there like, do you know what I used to do? Do you know what I used to do when we do the microscopes? I would be like, okay, cuboidal is like, you know, I'll write down notes with what I'm seeing so that I get a hint from when I'm doing the practical exam. I know, oh, that one was cuboidal. It was like this. There was some, because they usually use the same plates. for the exams. So I note that, okay, that one has that. Okay, let me go to the next one and see the differences. Because it's difficult. You've never been exposed to science, and now they want you to identify cells
When you're doing
from a microscope.
dissections.
You have to dissect. You have to make a muscle contract. Do you remember with the
Yeah,
frog?
with the frog, and they put that drum. But
And you're like,
the
what
effort
did I
they
put
put,
myself
though.
into? What? And it's just like the journey. When you compile and put it together, you just ask yourself, I went through all that. That was me. And wow, you become proud of yourself. You go through a lot, and you take in a lot, and you achieve at the end of it.
I came through a transcript of 4th year when we were doing therapeutic interviews, and I'm like, did I really interview someone?
Yeah.
Listen to the interview,
Yeah.
transcribe that thing,
Yes.
and then see if the communication was effective and non-effective. What are the stumbling?
Analyze it yourself.
Dude.
So the nursing journey, academia is very tough. It is, and you find yourself. The more you fail in some things, you pass in some things, but one thing I learned is that time is ticking.
Yeah.
You can't be crying over spilled milk. Nobody waits for you.
Yeah.
Semester is gone. We move on to the next
but move
semester
on.
with or without you. So that's how fast it was for me. Like it was. So first year I was just theory person. Even when I went to clinical, it was not that memorable. I think I started having the first hits of my clinical, that when I started enjoying clinical was December
Of
in
the first
20
year.
December of my first year in 2013. That's when it started to kick in, like, I'm a nurse. Okay. When you start, there's those moments where like a patient will just ask for something so simple. You give it to them and they look at you and they're like, thank you.
Thank you.
Because none of these nurses here want that.
I started feeding. Do you know, it's so weird. I started feeding from that energy. Like, oh, this is nice. For a granny to thank you and be like, you blessed my child. Ah, man. I was like, God.
Dude, you realize that in December?
Yeah, I realized that in
Oh,
December.
when I think we went to the hospital in
In April.
April. I met this other guy, and the conversation that we had, I was like, I want to be here.
No, I realized it because I was so scared of failing. I think the only thing that consumed me was my theory. I was very scared of failing. And one thing I can tell you is that throughout my 4 years, I never missed a day of work. Even if I had a test on Monday and I had work on Saturday, I would go to work.
You were that student.
Yeah, I'll still go to work and go and write that test on Monday and kill it.
Earlier you said you need to be exposed to the environment first before you can develop the passion. When did that passion develop? Was it
Second year.
Not in December.
Not in December. In December, it was just like, oh, shame. You're doing something for another human being. So for me, that felt like, this is what God called me for. Because, when you link your Christianity and doing things for people, that is what God wants. I always say to people, you can pray as much as you want, but if you're not doing right with God's people, you're not going to be blessed. If you're not doing the right thing, if you're not being that truthful person towards people that are vulnerable, because God looks into those vulnerable community, the sick, the widow, the orphans. That's where God is at. God does not come in rich people. He comes with the vulnerable because he's always there for them. I think that's when I also learned how I'm connecting my spirituality with nursing. How am I connected to God? I started seeing God in nursing. And it was even worse in midwifery. I think midwifery, that's when I confirmed that I see God every day. And I knew it.
There's one thing that you once said to me. Well, it wasn't to me directly, but we were talking, and you said the hospital. What is it? The hospital is the only place where you're gonna get blessings or curse.
Yes.
What did you mean by that?
That's what I'm saying, where the spiritual journey is. I picked up something. I'm always saying I'm spiritually aware. I always want to be everywhere I'm at. I want to be aware of my spirituality, my emotions, and my physical being. So there is a symmetry. We go to funerals. We pick up spirits there.
Okay.
With grieving people, they're vulnerable. Where there is vulnerability, there is a spirit. Whether it's vulnerability, there's an ancestor.
Yeah.
There's a demon. There's anything. So anything wants to enter. There's someone who died yesterday who wants to enter into someone's spiritual space. Because everything that is a spirit wants to enter into the physical realm. You know, it's nice to be on earth. I don't want to lie. It's very nice. I'm sure spirits, they want to enter.
What do we see here?
So for me, funerals, hospitals, and churches, that is the most dangerous spaces where you can pick up blessings and curses. As much as you think a church is a safe space, it's also a dangerous space. Because if you're vulnerable, any spirit can enter you. Any spirit can go into that realm without you even knowing. You might be seeing your life is going backwards. You picked it up from somewhere.
It could be church, it could be...
And the dangerous part about a hospital is it's the process, Mdaka, of being admitted. When you leave your home and say, oh, you know, I'm having a back pain. Let me just go to Bara and see. You get there. Do you know what that person is thinking in their minds? The doctor is going to give me pills. I'll go back home. The doctor says, no, I'm admitting you.
Sleep.
Do you know what's going on in that patient's mind? You're taking away their comfort. Their bed, their linen, their TV, their fridge, their food. You're taking away the times that they're going to be eating their supper today.
Their family.
Their family. This person starts praying immediately. They start saying, God, if I could. They start bargaining. They start panicking. They start calling their family members. Like, I'm being admitted. It's like a C-section. Tell a woman that they're having a C-section. Where? And Mina, as a midwife, I have this thing of every birth is special. Whether it's natural birth or a C-section, that's the journey. Let's embrace the journey as is. But as the African black community, we think a C-section is a curse. You're bewitched. Someone is holding on to that birth, you know. But from a midwifery perspective, a C-section is an emergency that needs to happen, or else you're not gonna have both the mom or the baby. It's a need. It's supposed to be there. So they don't do C-sections for fun. So same applies. That person starts praying. The moment they call their relatives, the relatives, wherever they are praying. Or by a path. So who are you inviting into that space as a patient? You're inviting God. You're inviting the ancestors. You go to the ward. You're anxious. That is why we have to nurse our patients holistically. Because the psyche is not stable anymore. There's no way you can find a happy patient in the hospital. That is why nurses will be like, yeah, patients are mean. What do you expect? I'm not in my house. I cannot access my food as I wish.
Exactly.
I cannot access anything. I am limited to this bed that you have given me, that I did not even choose for myself. So that person is screaming and frustrated and angry, standing with their ancestors and God, and you come and become a meanness. Those ancestors are watching you. They're looking at you. That person is praying against you and saying, Lona, uzonya. Dilangai. God and ancestors are dealing with a lot of nurses and doctors, I'm telling you out there.
So what makes nurses special? Sorry.
That is the thing. So you're thinking your blessings lie in those patients because they're vulnerable. And God hears them first. I'm healthy and fit. I need guidance from God. I need God to give me the strength to nurse this patient and that wisdom to identify so many things. Because you know, as a nurse, you have to be use your prediction very good. Like, it needs to be quick. You need to predict certain things. You need to see them before they happen and prevent them. So you need God to guide you to that. You need to open up your mind to have that. And without that relationship with the patient, you wouldn't know what this patient has that could put them at a potential risk of dying. And that, the moment you start treating patients the way that they are human, they're spiritual, they're emotional people, we'll be better nurses.
We
will be better nurses.
Are they cursed nurses?
I think they are. I really think they are.
How do you see those?
They are. Like, they are cursed nurses. Do you know, that's what I'm saying. This is all about spiritual wisdom. It's an individual thing that resonates with you. Do you ever do things that will make you feel guilty? You know? And nurses, some nurses, they know if we start discussing it, like, what made you feel guilty? They'll tell you that I think I snapped at a patient. I think I I did. I used to feel guilty when I was a student when I forget to give the patient a bedpan. I would literally call and be like, sister, I didn't give the patient, please, I'm begging. Because I won't sleep. I remember there was a time I tossed and turned at night until I called the ward at 2 o'clock in the morning. Because I was like, I'm not going to sleep. Lana, I'm not going to sleep. I need... Exactly. And do you know, I couldn't wait to even get to the ward and be like, I'm sorry. I was in a hurry. And I remember that guy was like, no, I understand. And I'm like, I couldn't sleep. I couldn't sleep. Just because I couldn't give you a bedpan. I forgot.
And there are nurses that actually would hear a patient calling and just ignore.
Exactly. Yeah, that one.
Oh, drama queen low, yeah.
I'm just like, this is a human being. Because I told myself, I remember when I stopped going to church when I started nursing. I did not become a frequent nurse, church goer, because I felt I was closer to God in a hospital than at church.
Wow.
I really felt that. And I enjoyed working on Sundays because I felt like this is a day that we're supposed to be worshiping God, but I'm worshiping God, spending time with vulnerable people that are praying to Him and asking for healing. So if I can be that light and that healing on that day, so be it. It shall be me. I don't need to be.
What does it mean to you when someone says, bless you, Nganya?
I see success. I feel like this person just gave me millions, right? Like, on a serious note, I see success. I see the prayers that work the most are the ones that people pray for you. When someone kneels down and prays for you, I think for me that is the deepest prayer than my own. Because yes, I understand my pain. But when someone takes over and says, please bless this person. Please guide. I remember there was one patient who came to me and said, sister, what's your name and surname? I tell her, like, Kwanele Mbazo, like, I'm going to pray for you. God is going to do wonderful things for you. Yeah, I cried.
It's hard.
I cried. I was like, and sometimes you didn't even do anything. You know, you didn't do anything. There's nothing that you did. In most instances, you know, patients that give you those blessings, you didn't do something that you thought was big. It was just something so small. But the way you talk to someone and look at them like a human being, it's so, it changes a person.
Why is it difficult for nurses to do that?
I don't know.
Do you not know, really?
I don't know. Because really, what I've noticed in nursing is it's a personal journey.
But we are seeing a lot of nurses.
Yeah, it's a personal journey. It's how, it's a personal journey that I think how do you interpret your pledge? We all have a pledge that is similar. We all read the same pledge at the end of the service. We all vouch for one thing. And that, you know, that word, I solemnly, you
as an individual,
as the wholeness of you pledge to protect this patient amid creed, race, gender, nationality, and to think that anatomy and physiology did not even teach us that this is how the African heart looks like, this is how the American heart looks like. We are taught a human body.
This is how the heart of a poor person looks like.
Exactly.
The heart of a rich person.
And to see that we take our personal experiences to work. We take our opinions of society to work. And some things are not even your business, you know? I remember there was a time that I used to fight with people. I hate people that shout at patients. Like, I'll literally, to the point that they knew that when I work when I'm at work, everyone will tell you that don't shout at patients when there's Sister Mbazo. Because I'll fight with you. Don't annoy me. Because what I carry is the integrity of nursing. This patient does not say Sister Mbazo shouted at me. She says nurses at this hospital are rude. And I'm that nurse. So you're not going to drag my name down the drain. You're not. I fight for my stand in nursing. That's it. So as long as I'm on duty, if you're going to behave, that's it. I'm good. You can misbehave when I'm not on duty. But if I'm on duty, I'm going to deal with you.
Where do
I
you
can't.
work?
Para. I think Bara taught me a lot. You see, when I come serve,
Yeah.
yar, I think I became a mean nurse because nurses were mean. I retaliate. I work with my environment.
Were you mean to patients or mean to nurses?
They're mean to nurses and they're mean to patients. You know, there is hierarchies. Like this patient is treated differently than the other patient, and I'm that person that I'm like. And families also come with that manipulation. You know, when they walk into the hospital and they start coming with chocolates and cakes, like they have this thing at the back of their mind, like you're gonna treat our relative better. No, I'm not here for that.
Yeah, I hated it.
And they bribe me.
And I got gifts.
Yes, they come with cakes, and you're like, these people, do they think that we're gonna treat this person? Any
But it
different?
does, because I've seen nurses actually saying, you know, prioritizing patients based on
Yes.
how their relatives interact with them.
Exactly.
Or
And I'm like,
patients-
that is not fair.
A patient in Ortho, but this was when I was a student, he actually offered to give me a motorbike. I still regret to this day why I never took that bloody motorbike. You know, but as a student, I started viewing that patient differently. You know,
yeah.
so I can imagine about those that have actually received and accepted
Yeah,
those gifts.
yeah.
What happens?
And I wonder, because for me, it was always a feeling of guilt. I hate feeling guilty. I always told people that I love sleeping, so I want to sleep at night. But I hate feeling guilty. I hate having to be like someone, like people will call you on the side. You know, family members will call you and say, like, you see, my brother is the one there. And I'm asking myself, why are you telling me all this? These patients are all the same to me. Like, I really don't have that space. And I used to love patients that did not have relatives that visit them, because I used to be sitting with them and talk to them, you know, give them my time, because they don't have someone to come and see them. Then there's those ones that come and like, yeah, sister, you see that what I treat everyone the same.
Nah, if I find
And sometimes you
yeah.
even get celebrities that want you to know that I'm like, yeah, but with me, it's not gonna happen. I'm sorry. You're all gonna get 5 minutes of my time.
And that's it.
There's no one who's gonna get extra, and there's no one who's gonna get extra food. Everyone gets enough food. That's it. There's no one's gonna get extra treatment. Oh, now we're running around for you. No, I don't have time for that. I do not have time for
Which department did you work in Barra?
Bara Comserve, I think I worked everywhere. I worked in medical ward, I worked in psychiatry, I worked in orthopedics, I worked in trauma, I worked in eye hospital. I went
So
to
you're
the eye
rotating.
hospital. Yeah, we were rotating throughout the whole year. So I think every month I was in a different unit.
So after Comserve, which one did you?
I went to maternity theatre. That's when I had to do. I love midwifery. I've always loved midwifery. I think that's where my passion really ignited. That is when I realized that there's God in nursing. You know, just mom and baby. Those for me are the simplest things to deal with.
How did you see God in maternity?
You know, there's creation. Maternity is more of being there in a special moment for this parent. That is their special moment amid of how the child was conceived, but there's that power in life, and you're dealing with two lives. There's that power in miracles also. I've seen things, you see things in maternity that you're like, wow.
What did you see?
There's been a baby that actually woke up from resource. Literally 1 hour post resource, the baby woke up. Like,
Wait.
like what?
Wait, after delivery,
Yeah.
the baby was declared dead.
Dead. And then an hour later, the baby started crying.
Hi,
We're all out.
I would run.
This child was resuscitated for an hour.
Wait, where was the baby then?
I don't know. And then an hour later, baby started crying. We opened up, the baby's pink.
You guys had already wrapped this baby.
Yeah. Identified the baby, body bag, everything.
We are waiting for mortuary to come.
Yeah.
I want to lie.
Babies, I'm telling you. I'm telling you, like you see miracles.
An hour later.
An hour later, baby starts crying. I was like, that moment when you're like, this is beyond us. This is not human doing. There's God here, and he just shot himself.
In Rahima, a mother decided to go and intentionally. Because that was not a mistake. After I sat down with her, I actually learned that actually this was intentional. She did not want the baby.
Oh, shame.
She went to the bathroom, squatted, like stood next to the, that in the toilet seat, and then she pushed. Baby came head first into the water, and she waited. Then when she saw Ran, maybe when she was convinced, Ran, now the baby is dead. And then she called for help. I was coming for you. Musi, remember how Raima Musa is
baby that you caught.
That baby. I came and I caught the leg and I pulled it up. Baby cried. That was a miracle. Was the mother of that baby, the mother was shocked in Bulel. It's dead.
And you can't move a person from a water to water. They'll breathe. Remember, they've been breathing all 9 months in that water. So they understand water levels, those kids. From water to water, you're not killing anybody. They're used to this. They can breathe.
Gradient.
Exactly. You're moving the person to the same environment. They can breathe, those people. So it was a very big blunder for...
How is the attitude of nurses to teenage pregnancies?
Woo! Oh my God. I don't want to even talk about this. Like, it makes me very sad, It really annoys me.
And to think that when you were a teenager, when you had you were not a teenager.
Even a teenager. I was 20. And then, when I did my midwifery, you'll receive patients in theater, like 14-year-olds and 13-year-olds. And what annoys me and what really breaks my heart is how everyone reacts as if this child likes things when nobody's communicating with the society back at home. Who is making these kids pregnant? Nobody questions that. It really annoys me that nobody questions who makes this girl fall pregnant. But everyone questions the child. Like, you like things. I remember there was a time we had a patient, she was 12. I think the youngest I've seen is 12.
12?
Yes. You do get very young. And for me, what's sad is that who slept with this child?
At 12 years old.
Who did this disgusting thing?
At
Because
12.
as old as I am, I have people that I know that are women like me that can't even stand up for themselves with a man. And then we're going to come to a 16-year-old till a 12-year-old. How do you think they can talk and advocate for themselves? These are kids that are abused by people that they know, people that are older than them, people that manipulate them into doing this, people that are, it hurts that there's someone who is dirty-minded enough and old enough to know what they're doing is wrong, and they do it on a child. Then we, as nurses, take it to the next level. Because in clinics, I've seen kids being scolded for getting just a contraception. There's so many things that nurses say, man, that are so hurtful that I'm like, well, how is this child expected to come back and get contraceptive if you're going to talk like that? As a nurse, there's sometimes that I wish that I worked in a clinic just to hold on to these teenagers and have that system that I send them a message and be like, come and get your contraception. I think society needs to start, mothers, families, parents, they need to start understanding that once a child is at puberty, they're free game. Anything can happen. The body itself is saying, this is a woman. This womb can carry a baby. So it's up to you, the parents. How do you take over and control that this does not happen? Because most of the people that impregnate these kids are uncles, are people that they know, people that are around, people that they trust, and people that if they say something, they know that my family is over. Kids are very smart. Kids can actually consider consequences before they even say something to you. That is why most of these teenagers will keep quiet until the pregnancy is big enough and now you can't even do anything about it. Because they think about the consequences of saying, uncle did this to me. No one is going to believe you. Or someone did this to me, or a community leader did this to me, or a pastor did this to me. Because these are people that are respected, people that someone is not going to expect
to do such.
Yeah, because it's not like every teenager that is 13 years old is dating a 15-year-old. No, it's not even dating. It's people that are older.
Some of them are sexually harassed.
Exactly, they are raped.
Yeah, they're raped.
And when, as a nurse, you can't judge. You don't even have a right to question how they got pregnant, especially if they are from 12 years till around 17. You can't question how they got pregnant. And what saddens me is the journey becomes even tougher, because from the moment this child found out that she's pregnant, she was embarrassed, humiliated. She's like this. The whole society looks at her like this child that loves sex. And you come into a hospital setting to deliver. Oh, the nurses are gonna grind you. And I'm like, this is only 3 days or 2 days of your whole miserable 9 months where everyone has been making you look like a sinner, a person who can't make decisions, a stupid person. How do you throw away your future like that? Then the nurses top it. Instead of supporting that person, instead of giving that person love and support and make sure that they don't come back, you don't make someone not come back by being harsh with them. Because I remember there was one nurse who even said to some teenager, like, yeah, kids your age are in school and you're busy thinking about sex. Why are you not choosing a condom? Do you know, my response was, I looked at her, I looked at that sister, I'm like, can I ask you a simple question? Right now, in your love life, can you negotiate to use the condom? Are you able to do that? Are you able to argue with your men right now and say, I don't want unprotected sex. I want a condom. And she kept quiet. Like, no, I need your response. Like, at your old age as you are, can you negotiate protected sex right now? Like, as old as you are, you can't even.
How do you expect a 12-year-old?
How do you expect a 12-year-old to negotiate that? You can't be bashing those kids. You need to be bashing the person that impregnated this child. And it needs to stop. It needs to stop, because there's an adult out there running around impregnating kids and with no remorse whatsoever.
Are they showing the same attitude towards advanced maternal pregnancies?
No. It's not. Oh my God, so coco. No, like, no, it's not. Do you know what I've noticed is in midwifery, there's always the problem with the teenager and the foreigner. That is the biggest problem. And I think sometimes I find nurses are educated, but sometimes they behave like they're not educated. Because there was one debate that I had at work when someone's like, yeah, these foreigners come here to get birth certificates. But I'm like, which birth certificate? They're like, yeah, at Home Affairs. I'm like, Home Affairs does not issue birth certificates to foreigners. Ever. Home Affairs, at a hospital setting as a midwife, I fill in the birth notification form to prove that I was there. This baby was born at this time on this day in this ward or unit. Then this form is taken to Home Affairs to produce what they call a birth notification. That birth notification, you take it back to your country. That is where your ID is, your passport is, with your husband. And you take it back to your country, and your country gives you a birth certificate. It's like me going to London. I'm not going to get a birth certificate from London. I'm not from the UK.
Get citizenship.
No. The child gets citizenship if one of the parents is South African. If both parents are not South African, Home Affairs issues a birth notification. That notification, you need to take it to your country's Home Affairs and say, damn, I was visiting South Africa. I gave birth. So give me a birth certificate. And your Home Affairs is going to do that birth certificate for you. Like, that's what I'm saying. If I had to go to Canada right now, I give birth in Canada. I'm not a Canadian citizen. They'll give me a notification. I have to come back to the South African Home Affairs and say, I gave birth in Canada. Please record this child. And then they record that child as a Canadian born by the South African citizen. That child is not a Canadian. Where do they get their citizenship from? Who gives them the citizenship? Nobody.
So you get South African born.
Exactly.
But Pakistani citizen.
Exactly. You can be born in any country, but if your parents are not nationals of that country, nobody issues you a birth certificate. Same applies with Home Affairs. They issue birth notifications that just notify the other Home Affairs that this person is proof that they gave birth in South Africa. So when you prepare their birth certificates, please consider that. Because the child was not born on that soil. So it's just to notify and communicate that the child was born in another country, but this is your citizen. It's not ours. But if one of the parents is a South African national,
Then
by all means, the child gets the citizenship. Do you understand?
Yeah.
So you start and when I actually decided to educate people about that, that's when everyone was like, oh, okay. So I'm like, all this time you think these people are crossing from Mozambique, Zimbabwe, Zambia, wherever,
Because
they
of
want a
this.
birth certificate. No, the hospital systems and services in other countries are horrible. Some just want to come and give birth because it's so expensive to even give birth in their own countries than to fly and be here. I remember once met a woman from Sierra Leone. She literally told me that she'd rather take a flight to South Africa to give birth than give birth in her own country because it's expensive.
Yeah.
I think when I was a student, I saw
Yeah.
was he Pakistani or what? He said my husband is sleeping at the garage while I'm delivering.
Exactly.
As soon as we are done, we're going back home.
So for me, I think as a student, I appreciated that influx because it gave me more clinical skills. It was more like that give and take type of thing. So I was not obsessed about foreign nationals because I was like, they gave me good
Push
midwifery.
numbers.
We had to push numbers. You have 15 deliveries and you have a class of 50. None of you are going to have the same delivery. You must be joking. When are you going to get the 15?
And you see a lot.
When are you going to get
And
15?
you see a lot of different things from these people from different countries.
Exactly. You learn a lot.
Learn a lot.
You see a lot. And how they respond to say some bleed a lot because of the things that they eat or their environments where they come from. So you learn, oh, this is how the human body functions.
Some of them, I saw one with, I forgot the country where she was, where they had cut off her clit.
Yeah.
Where,
When they circumcise.
yeah.
Oh man,
Yeah,
it's
that was
like,
something else.
so you learn. You learn a lot, and I think yes, it burdens the system. Yes, people are tired. Yes, but on the lighter note, it gives us a lot of experience.
Yeah.
It trains us. It makes us the nurses that we are.
That we are today.
If you're willing to learn, you want them to come and get those deliveries.
And I think that's why doctors from other countries, they want to come
They
and
want to come to South
Bara
Africa and go
because
to
of
Bara
this.
because of that exposure. Because especially at Bara, the exposure is insane. I always say I wish everyone and anyone can just work 1 year at Bara. You will be a different nurse. There's so much exposure at Bara. It's insane. You can see everything that you read about in the textbook that is unique. You'll find it at Bara. You will find it at Bara. By no means you will get it. And it's interesting. It's interesting how everyone embraces that condition and treats it, and the patient gets discharged. I think for me that is like wow.
There's better outcomes. in
Yeah.
Para.
There is better outcomes, and that's what people don't see. They see this hospital, this huge hospital that if I go to Bara, I'm gonna no. If you go to Bara, you actually have a higher chance of living.
I was once disturbed when a mother came with what do you call it? I forgot the term. With a stillborn,
Shame.
right? And we put her in a separate stage room. We helped deliver the stillborn, and after that, the husband came to join. This was back in the Rahima time. I remember seeing that father crying.
Shame.
Oh, that touched me.
No, do you know, it's so like I always say to people that you only understand a stillbirth when you know what that pregnancy meant for you. Some pregnancies are not just pregnancies, people. It is the growth or the mending of that relationship. There's so many cultural issues that you encounter when you meet women that are pregnant. I know I've met people like one person that had been pregnant. That was the 12th child. 12. Because she wanted a son. 12. And the husband had already married another person. And because she's the first wife, she still felt the obligation to deliver
A son.
and the tears when she got that child were like man, I was so humbled. I remember that day, I literally went out and I cried. And I was like, this is what these kids mean to these women. It's so insane how this world is. You know, keep on like, yeah, we're empowering women. Damn, you can't just empower people when you don't understand where they come from, when you don't understand their belief system, when you don't understand the things that shape them. Some women are giving birth because they're trying to save a marriage. Some women are giving birth because the husband has already chosen another person to come into their place because they can't give birth. So you can imagine what the child means to that person. And when that child does die, before they leave, you can imagine how much hurt that parent is going to go through. How much she feels like she's going back to zero. She had tried, she had managed to get that baby into her womb. And that baby doesn't make it. So there's always a story behind every pregnancy. It's just that we all assume that it was unprotected sex. Then they just no. There's always a story behind every pregnancy. If you listen, you'll be humbled by the society problems that women go through on a daily basis, and they have to make that decision of actually, you know, they have to make that decision of actually, you know what, I need to get pregnant now because this can save my marriage, or this can save my relationship, or this can make me feel like I am the first wife,
or I'm a woman.
Some women just want to be pregnant to feel worthy of being a woman because they have a womb.
My mom told me that before she could conceive me, the prayer that she made was that just so that I can show that I'm a woman. Even if the baby dies, I don't care.
Yeah.
Just so that I can show.
It's so funny. You know, that resonates with all of us. I know, you know, when you're getting married. It's different when you don't have a child and when you do have a child. The strength that you come in with in that marriage, and like, I have a child. So even if it takes 20 years for me to give birth in this family that married me, I have proof that I'm fertile. It's like our lives is so centered in that cultural belief that a woman needs to give birth, and it for me it actually damages women, because that becomes a focal point, that becomes a point of departure,
obligation,
a duty, you know. And I always say, there's no beauty in being pregnant because you want to get pregnant as a woman. That is beautiful. That is very beautiful. That you like, I wanted it.
My decision.
It was not an obligation. It was my decision. I felt ready at that time and I wanted it. And I always wish that for every woman, that we get to that point where we decide that I want to fall pregnant. I want to have a baby. Me. And when it starts there with you, no matter what happens with that husband or that man, you are content. You're happy with your seed. You're happy with that baby that you bring. Because, damn, there's so much. A child is a responsibility of, I think, two people. That is why even the Bible says, I was talking to Andre saying that, you know, this sex before marriage is true. God is protecting us. Because you have it. You're starting a lot of problems for yourself. So, but in this time that we're living, you need to decide as a woman that now I want to carry a baby. Because it's an emotional turmoil. It's a lot. Your body changes, your emotions, your hormones, your brain, your thinking. You sleep all the time. You know, it's just horrible. But once you've taken that decision as a woman, you embrace it. You enjoy the journey. You appreciate it. You know, you go further. So I think for me, that is why I always loved midwifery, because I get to listen to those stories and I get to see how powerful women are in their own way. And we all have this society power that, yeah, the working woman is powerful. No. The alive woman is powerful.
That's beautiful.
As long as you're breathing and you're a woman, you don't understand your power. It's insane. A mother, a woman, is one species in this world that, you know, they'll humble you. the things that parents and moms do. That is why there's Mother's Day, guys. The things that a mother can do, a woman can do, is wow.
How do you deal with the maternal deaths or
Oh!
fetal deaths?
Oh, you asked me a very sensitive question. Maternal deaths are horrible, Mdaka.
Have you had any?
Yes. No, maternal deaths are so horrible. It's like, it's like you lose something, like, whew. At some point in a midwife's career, you cry with the mom when the baby is lost and comfort them, and hope that they can conceive again and come back. But a maternal death is like the most horrible thing. This mom carried this baby for 9 months, comes to the hospital, and anything can happen. And now you are all declaring this person dead. The one that left and they were ready to receive the baby. And the pain of also handing over that baby to the father or the family.
Without the mother.
Without the mother. The grief. And you ask yourself, how is this child even going to cope when they hear that your mother died giving birth to you?
No.
And no, maternal deaths are horrible. I remember even they will notify us even when we're off that we're the maternal death in the complex. And you can feel it. You can feel it from the roof of your house. It's a grieving time. You can even feel when you walk into the labor complex that there's a death. Nobody's happy. It's not nice to have a maternal death. It is one thing that I think with the Millennium Goals, it was one of their biggest targets.
Yeah.
It needs to be reduced at all times. So everyone has to answer. When there's a maternal death, everyone has to answer. What did you do? When this person came in, who did what? How did you do it? The whole point is to avoid it next time. But I think it's stressful, especially for the people that were involved. It's not nice. It's really not nice. And in most instances, I've noticed that maternal deaths always come with unbooked patients. It's not the booked mother. That is why people have to be booked. You need to, when you find out that you're pregnant, go and get booked, because we want to pick up those risk factors. We want to pick up those things that can cause you problems in birth or during labor. But most patients, most moms, you'll find that because they have experience of the previous baby, I'm not gonna book. I know I've given birth before, and you forget that pregnancies are not the same. You can't use your previous experience of 2 years ago and think it's gonna be the same now. It won't. It might be a difficult pregnancy. It might be a pregnancy that gives rise to your diabetes, your gestational diabetes, preeclampsia. It can happen that you have a difficult pregnancy than what you had. So with pregnancy, there is no experience, that I always say. But maternal deaths are just horrible. I don't wish it on anyone. They're just really horrible. They're not nice.
What is it that you hate most, or that you don't like, that patients, that patients, I would say patients, or new mothers, or mothers that are expecting, whether it's new or you are a returning mother, that they do? What practices? I was speaking to Mr. Mshengo in another interview, and he said they drink. Abo mama, they will come to the hospital after drinking this Islambez.
Where patients abusers, and when they drink that, when they've drank it, they come looking like so innocent, and you put them on the machine. You're like, "Hi, mama. This is not a normal contraction. What did you drink?" "I didn't drink anything," and that causes a uterine rupture. I'm like, they're augmenting. People know science out there. I'm telling you, they know science, and you're sitting there. You're like, you are frustrating us. You're putting us at a risk of a litigation, and we are gonna be in trouble, not you. And your patients do a lot of things. But I won't talk about the slumbers or part, but that one will irritate you. You'll be like, I can't, no, this is not right. And like, I think another thing. No, they want to quick, quick, done. But you don't understand, you're not giving the uterus time to breathe now. You've put something that augments it to start contracting, and it starts contracting. So they induct, some augment. So there's ones that started, then there's ones that when they feel the pain, they're like, no, this pain is not enough, it's going to delay me. Let me drink this thing. Then it's augmented, and then it becomes more. And the uterus can rupture. But I remember when the uterus is carrying a baby, it becomes thinner and thinner and thinner and thinner. So it's at a risk of rupturing. You can rupture it and lose your life.
We've got people that can make traditional syntocin.
Syntocin, yeah. And people are very smart. You think people don't know anything. People know things. They do things to get to a certain level. And you're like, how did you even get here? For me, I think what really gets to me personally is breastfeeding. It takes these most moms, it's like they're ready not to breastfeed. There's that thing, and I'm asking myself, why? You get those people that are like, I'm not ready to breastfeed. I don't know what exactly, because everyone has a personal reason. I've noticed that there's moms that will really have those personal reasons that are personal to them. They're like, no, I'm going back to work in a month's time. But I'm like, you can still breastfeed your child in that month. Give them that benefit. Give them that gift, Then some will tell you about their breasts, they're going to fall.
Oh, I don't want to have sagging breasts.
I'm like, okay, cool.
Is that thing really happening?
Nah. Come on. They don't... You get back to normal. Your breasts come back and go back to the way they were. They won't sag. So I'm like,
so these are the myths that are around.
Yes, and but I'm liking the fact that in the community, in the society, in social media, people are encouraging breastfeeding more and more. And I think another thing with breastfeeding, it was always about breastfeeding in public. People look at you like it's nasty. You have to go into the toilet and breastfeed. You have to hide while breastfeeding. And you ask yourself that, but you eat when you're walking in the mall. Why can't a child eat? Why should they go to the toilet? You don't take your food to the toilet before you can think of eating it. You eat it and walk to the shop. So why can't a child breastfeed while the mom is walking and carrying their child and the child is breastfeeding?
Because you want to take your boobs out here.
No.
We are busy doing shopping and when you want to take out your boobs here.
But that is the baby's food. Same as the food that you bought at Woolies and took your juice and ate your pie.
Well, you can't take your boobs out in public.
You can. Yes, you can. And that is why some people are not even keen on breastfeeding. Because they're like, now I have to take out my breasts in public and people are going to think it's disgusting. No, this is the child's food, period. If you have a problem with it, get me arrested. I'm not breaking anyone's law. I'm not. And for you to even look at that breast and think it's public indecency is very weird when men pee everywhere. Men pee everywhere. Finally, the floor is someone parked there, they're peeing.
I want us to go towards your masters and your topic because I find it very interesting. Someone that is now currently doing nursing, I don't know how many hours I've been talking for.
I'm sure 5.
It's okay. That's the beauty of it. For someone that is doing nursing or wants to do nursing, or even thinking, nursing as a career, what advice should you give to them? Let's start with someone that is thinking of nursing as a career.
Dude, I don't even know where to start because there's so many things from an educator perspective and a nurse perspective. There's so many things that I've actually seen that I feel like nursing should come from you. You need to know where your hunger is. I'm not gonna say that nursing needs people with passion. Some people think they have passion when they leave home until they have to face the real deal. Then the passion is like, I don't have it. I'm done. I'm leaving nursing. Some people have it. And like me, I was influenced by the money, but I became a very better nurse than I would have thought. I never thought I'm going to be like, nursing is a calling. I'm called to do this. But at some point, I really saw that, damn, I'm meant to be here. There's something that is making me to be here. So for me, it was a goal. I had a goal, I had a vision. And that is enough to achieve anything. Not even nursing only. But that is enough to take you somewhere. Once you have a goal and a vision, you have something that you can achieve, and you have a place where you see yourself. So whether it's in engineering or whether you want to have a degree, you're gonna have that degree, but you need to have a goal and a vision. You can't look at other people and be like, I want to be like that person, but you don't know my journey, you don't know the instance of my suffering, and you might not make it. You might not make it to where I am, because I'm a risk taker. People that don't know me, they always be like, this one. I'm that person that can just be like, I can work in a place for 6 months and like I'm done.
I don't want this.
I don't want this anymore. And I can.
I didn't resign.
Yeah, I'm that person that can really wake up in the morning and be like, I'm resigning, and everyone's like, you don't have a job. I'm like, I don't care. I was not born with a job. I don't care.
So what would you advise someone?
So
Know your passion.
know your passion.
Know yourself.
Not even your passion. Know your goals and your vision. Where do you see yourself in 10 years' time? And always have that room, not for disappointment. Always have that room that it might not be your thing. Stop applying for things that you don't get accepted in. Just stop it. You can't come and tell me that you have been applying for nursing for 6 years. Aibo. It's not for you. Go somewhere else. If you failed here and now, go and do something else. There's something waiting for you that is meant for you, but when you might think you're not meant for that thing, but it's probably that is the one for you.
Would you advise your child to do that?
No.
That was the first no.
I don't even want to hear it. I'm not even gonna be interested the days like, mommy, I wanna be. Wait. I'm like, my daughter cannot be a nurse.
Why?
No.
I
can't.
Who's gonna nurse us?
No, there's other people that are gonna nurse you guys, not my daughter. No, my child cannot be a nurse. Do you know what my vision that I have for my child is? I want her to do what she loves.
What if she's nursing she loves?
No, where does she know it from?
She's seen mommy doing it.
No, she can't. I'm not. I'm actually.
Yo.
In everything that I'm doing.
I'm gonna carry 5 rand with me every day. I'm gonna carry 5 rand every time in my pocket. And the day I meet a nurse, let's say I would advise a family member or anyone to do nursing, I would give them. I haven't met.
Out of all my interviews.
Guys, it's horrible. Do you know the spiritual burdens that nurses carry? Do you know that nobody comforts you when a patient dies? Nobody cares about you. Nobody cares about you when you dream of kids. I remember one thing I said, I'm not going to do pediatric nursing, is because the pain that child carries, I dream about them. Nobody looks into that. How do I sleep at night? Sometimes I'll even ask God, that do you even exist to inflict so much pain in a baby that does not know anything? I don't know how many times I've questioned God because of nursing. I've seen things that I feel like there's unfair. Who are you punishing through this innocent child? Are you teaching the parents a lesson? Or
What are you trying
or is it just a balance? And if it is a balance, why will the child suffer? So there's so much, we're strong people as nurses. We go through a lot. We go through so much that we don't even get debriefing in some of those things. These people, like, I lived through the pain of Ngaba working in medical.
I still need to talk to Ngaba.
Like, that's horrible.
I want to talk to Ngaba.
You need to talk to him, because I learned the other side of society, that people can do strange things to people. And you're thinking, oh, this one deals with rape cases. You're thinking people don't get raped until you meet a person that works in forensics, dealing with rape cases every single day. There's no day that he came back without a rape case. And you ask yourself, what about those that are not reported? What about them?
What about those that are killed?
What about those that don't even make it to that level of reporting? So nursing is, no, I wouldn't wish it on anyone. Yes, nurses are gonna be there. It's fine. And I feel like sometimes it's like this glamorous thing. Like, yeah, I'm a nurse, but damn, we're broken. It's glamorous. Especially when you put on your epaulets with your bars, you look like you've arrived. But
I'm telling you.
it's a lot of things that we're carrying. That is why I had to leave clinical very quick and fast, because I wanted to leave nursing with its integrity. I didn't want to leave nursing clinical hating nursing, because I did not come to nursing to destroy its image and its integrity and its nobility. I came to grow in it and inspire as many people as I can and help as many people as I can, but I also did not want to come out hating it.
Others would say it's already broken. It's no longer intact.
What?
Nursing.
You think it's broken?
I mean, the perception that we have from the public out there.
Oh, it's horrible. Nobody likes a nurse, eh?
So you wouldn't say it's intact?
Nobody likes a nurse. But it's so weird. You know, there was a moment this week, I was wearing my uniform and I went to the mall. Damn, you know, a lot of people were greeting me and I'm like,
Hello, sister.
wait, which nurse do they know? Like, hey.
Hey.
Like, literally people like, hi, sister. I'm like, hi, how are you?
Maybe we are in the process of reviving nursing.
I don't know. Maybe COVID brought it back to us. I don't know, but people were greeting me, and sometimes I really get scared to wear epaulets and uniform to the mall. Sometimes I just need to get to the mall, and then I'm like, damn, I can't get home and remove my uniform. Let me just go in, and wow, I was literally shocked that wow, there's people that greet nurses. That is so nice. That is really nice. That okay.
Do you think they hate us that much?
No, people hate us. Oh, people hate nurses. I don't want to lie.
Why do you think is that? Is it our doing or what?
I think it's our doing.
Or is it because we as nurses, we don't love the nursing so much to even recommend it for our kids?
I don't think it's no. You want to. For me, my vision for my child, I noticed my growing up was more on school, academic. It was so around that. And with my daughter, I want her to do what she loves. I want to give her that opportunity to. If you want to draw. If you want to dance. If you want to act. If you want art, because she loves art. So I can't take that away from her and be like, it won't make you money. I think there's nothing as beautiful that we found out that sometimes it's not about money. Sometimes your purpose is doing what you love. It's not about money. Sometimes we think we have a purpose, but there's money behind it. But what do you want to do that you like, this resonates within my soul? I love this. I cannot, even if you wake me up in the morning, I'm going to do this. I was not trained for it. It was within me. I was born with it. That is what I want to give her. I don't want her to think like me or be an academic. If she becomes an academic, it's beautiful. It's a bonus, but not for me.
Yeah.
She needs to do it because she wants to do it. Not because she's forced to do it. Not because she thinks I'm supposed to be like my mom. I want her to be herself.
So for those that are currently doing nursing, what would you say what would be your advice?
Nursing, they should continue. They now know what is happening. And the journey is tough. I always say to students, at the end of the day, we come as a group. We were 50 when we started. And I think from our original group, we were 22 when we graduated.
Yeah, 22.
And that's the reality of life, actually. Nursing teaches you life. Because you might be a lot when you start. But as we grow older, we become lesser. A lot of us might not make it to 50. Or even to 60. Some, by the time we get to 70, will be probably 2 alive. And talking about the rest of them that have died. And that is nursing. It's like that. It's life. And from 22, we were 2 at Barra. Others were 5 at Helen Joseph. Others were 5 forever. But one thing that stood out was you were alone in that unit.
Yeah.
It was now you and the patient and your skills. So whatever you do, accumulate enough skills to make you a reliable, safe nurse. It's not group work.
Because we have unsafe nurses out
there. Nursing is not group work. It's an individual journey. Because at the end of the day, you'll be faced with a patient in your consulting room and you have to come up with a diagnosis. You're not going to call your friends. Yeah, this person woke up in the morning trusting you that you're going to tell them what's wrong with them and give them the right medication. And that is how much trust those patients have on you. So if you're going to think that this is a group game, it's not. It's an individual game. It's you. You. It's only you. That's it. I don't take my skills or my skills to work. I take mine. I'm me when I get to work. I'm my knowledge. And when you get to those high places where you have bosses that you have to do reports to, you realize how accountable you have to be. You understand accountability now. You know, I remember when you have to work in teams, accountability is blurred.
Those social loafers, didn't they?
Exactly. Wait when you have your own position that requires you to work. Then you like, damn. Sometimes you thank God for your discipline. That I'm disciplined enough. I can put up a report every week. I can work and be. You know, I think for most of my jobs after I left clinical, they required me to be independent. Because when I became a research nurse, I had to give reports to my bosses in Cape Town. These were people that I was not even working in job work. They were in Cape Town. We have to do a Zoom meeting and I update them that this is how much I collected. This is what I found. This is the problem. These are glitches with the questionnaire. Please fix this and do that. So you have to work at your pace because I was working from home. You have to be transparent. You have to work and show that you worked. But nobody comes to you on your neck and be like, did you do the job? But you have to report that job and they have to see it. So now it's a question of discipline. You're going to have positions that require you to be disciplined. That nobody's going to be walking around you. You have to be independent. I remember when I became a clinical training specialist, the same thing happened. I had to run the show in the hospital. I had to do my own training programs, do this, do that, and report on Monday. Because this is what I did. This is how many people I trained. I did this in service and I did that. And nobody has to tell you all that. You have to figure it out yourself. You have to see how you come to...
As a professional.
As a professional. Because you trained most. So you need to figure out your schedule. Like, how am I going to reach this? So everything starts now. I always say with students, everything starts now. If you think that, if for now, in first year, you're not seeing a professional nurse, you'll never be a professional nurse. Forget it. You'll never be a professional nurse. I remember there was a time that Busi was like to me, do you know that when we graduated, she's like, do you know that in 2013 there's something that you said, Kwanele? You were like, in 2016, I am becoming a professional nurse. And she's like, you're the only person in class that actually said that. And I looked at you and I was like, she sees herself graduating.
Already.
And I don't even see it.
That time we were crying, if Anna told me, yeah, she's already
I
graduating.
remember first year I kept on saying 2016 I'm graduating, 2016 I'm going on the pillow paper train. It is what it is. I declared the pillow paper train before it was even known to everyone in class. I knew that I was going on that train from first year when I was given that Baker policy and I read about the pillow paper train. I was like, this is my goal. I'm going on that train.
And you did?
Even if they choose 5 people, I'm going to be part of the 5. Period.
It's like you plot your life and then you just
Yeah.
do things to... Wow, that's beautiful.
Yeah.
What would you say to nurses that are now not the students, the nurses that are already in the system?
One thing I can tell any nurse that is in the system, guys, if it's toxic, leave.
Babe.
There's places that you can go to. Do you know when you open up to the world, when you open up to the universe gives you those opportunities.
Wow, you see, you're being philosophical.
I'm being philosophical, but I'm being real. There is one thing that we tell ourselves that traditional nursing is, I've seen guys, from the time that I became a nurse at Bara and when I left Bara and all the journeys I've gone, I've met nurses that are not doing what everyone thinks nurses are doing.
What are they? Let's
Nurses are
tap into that. What are nurses doing?
Nurses are doing research. Nurses are traveling. Nurses are nursing people individually. Nurses are opening practices. Nurses have businesses. Nurses are, like, they're just everywhere. Nurses are DDs in departments where you're like, you're a nurse.
Oh, you're really a nurse.
Seriously, yeah. It's not clinical or academia. Nurses are doing things. Nurses are in places that you like, wow, how did you get in here? How? Nurses are in Department of Health, changing policies. They're everywhere. You can do anything. as a nurse. You can even add another degree and top it on nursing. Nurses are doing law. Nurses are attorneys, and they're nabbing other nurses. Nurses are analyzing cases for attorney companies. There's so many nurses are consultants.
They're in insurance companies.
They're insurance companies. They're in fertility clinics. They're in, people are doing things out there, guys.
So as much as you wouldn't advise people to start nursing, but it's quite a broad
It's very
profession.
broad. If you allow yourself to see beyond clinical, nursing is very broad, and you can have very exciting jobs that are like, wow. Nurses, some work for insurance companies. They're case managers. They analyze claims. There's so many things that nurses are doing if you put yourself out there. And it's not about putting yourself out there. I learned that the more you attend conferences, symposiums, you hear things. You're like, what? There's something like this? Yeah.
Done by nurses.
People are out. People are not sleeping out there. You might be stuck in your house and thinking, this is my life. People are working. People are doing things. People are developing stuff. And those are nurses. People are just tapping into walls and doors and they're going in. And you just sitting there like, I'm not getting. You can actually decide your own salary increase. I always hear people saying, we didn't get a salary increase this year. No, I decided on my salary increase. I think I've had 3 salary increases after I've left Para on my own. You move from one employer, you negotiate another salary. You move to the next, you negotiate another one. In a year, in a space of a year, salary changes 3 times. And that's it. And the more you grow, the more you become expensive.
Why do you think is this knowledge of how and where nurses can go and navigate to is quite rare to nurses?
How is it quite rare?
Are nurses lazy to find out this? Because we still have a lot of nurses in clinical.
Nurses don't network.
Okay.
Need to network. Like I'm one person that I'm telling you, I network more than anything. I ask questions. I'm so brave to ask questions. When I meet people that I feel they are doing something, I ask them questions like, how did you get into the thing and what was happening? And people tell you. I will never, as I know for myself, I'll never withhold information from anyone. I'll give you the information. There's nothing you're gonna do. There's no one. And actually, what I love about nursing is no one can take your job in nursing. We can all be in the same position, but you can't take my job. You can't come and replace me. So I'm there by the right of my skills and qualifications. Even if I invite you to come into my space, you gotta take your position and your own responsibilities. So nobody takes anyone's job in nursing. So by sharing information, you're not gonna be. And also, it's success. Remember, there's a certain caliber of people that get to the top.
So not everyone will.
Not everyone will get it.
So not every nurse will.
That's the thing. There's a certain drive, I'm telling you. If you don't have that drive, if you don't have that vision, you have to see it for it to happen.